Okay, we are here at Face Aesthetics Medical Spa and Mathew Epps, MD, Plastic Surgery. And why are they both under one roof? We're going to talk a little bit about that. It is so important. Jane Epps, nurse aesthetic practitioner here, and Dr. Epps, nice to see you.
Good morning.
So this is exciting for me to chat with our viewers about because it really is great when you have a consult here. You get both of you and you get to really dig in and talk about some of the concerns you might have. Why is that so important?
Because each individual is different with whatever their goals are and where they're at in terms of age, and that's really important to consider when you're thinking about surgical and non-surgical treatments to when your goal is facial rejuvenation.
Yeah, and I have to tell you, there's been several med spas that I've been to over the years in our quest for youth, right? Mm-hmm. And you often see a doctor that's practicing at that med spa. Usually, though, you see just their photo on the wall, and that's pretty much it. I've certainly never met any of them. So it was really unique when I got to come here for a consult, and I actually sat down with both of you. So I got to really dive into the services of the med spa, but then I also got the doctor's eye and got to ask questions that were really specific to that. So tell us a little bit more about a consult and like how, Dr. Epps, you really go into looking at a woman's face and maybe some of the things that are possible.
Absolutely. So usually how we start out is you have to look at people's skin and a patient's skin, because in the end, what I heavily focus on is facelift and eyelid surgery. But if you tighten skin on the face, but the skin doesn't look good, it tends to have the same result. And so your first goal is to bring back the skin to the level it should be and to look healthy again. And then the patient often feels healthier going to surgery, and they heal better if their skin is hydrated and has good blood flow and is restored prior to any kind of facelift or eyelid surgery. The additional benefit of having both a surgeon and a skincare med spa aesthetics expert such as Jane in the room is that we know our limitations with the med spa, and we also know our limitations with surgery, and we can blend those at that exact time. We don't just offer you services that are within a medical spa or services that a surgeon would only offer. So we truly do tailor the results, and we tailor the treatments to the results that we're trying to get. And also what we need to emphasize is that every person should, within their yearly budget, start to budget plastic surgery or medical spa treatments, because it's a process. And if you can prevent the aging as you're aging, ultimately, in the end, it's much better financially, and it's much better as far as your skin. It takes a lot less to maintain than it does to take people back 10 or 15 years.
Yeah, I actually enjoyed that you talked to me a little bit about that, like having really the long-term plan, budgeting for the long term versus just, okay, this is bothering me today, I need this. And actually, that's another point I wanted to touch on is a lot of times when you go for a service, or you might be looking in the mirror and something's bothering you, you go tell them what you want. And you say, hey, I need an appointment for this. This is a reverse approach. It's, hey, I'm gonna set up a consult, and then we're gonna take a really good look at your skin, what you've been doing. I actually brought my products in, lined them up for you so you could look at them and really get a plan. And it might be something that you didn't think, and there was a couple instances where we talked about some surgical options, and you said, you know what, we can actually fix this through the med spa and some of the services there. So you really take a look at the individual.
Right, and one of the most important things is to look at the individual's schedule in their daily life and see what's practical for them. So some people can take 2 weeks off for a surgery, as other people work right through it, have children or have a profession, or otherwise just and are not in that point in their life where they want that or even need it. So then we take that and tailor that to that individual and say, well, I believe that these treatments will be more effective, more efficient, more budget-like, and in the end, we'll come to the same conclusion, but you can continue with your daily life without disruption. And that, to me, that's the most important thing.
Yeah, Absolutely. Well, I think the nice thing to do is you can schedule a consultation and really work through all of those questions as we all kind of combat the years that come. And
Right.
I think a lot of women especially look in the mirror and just have a lot of questions. So stop in and grab a consult. It was so nice to talk to you, Nurse Epps, Dr. Epps. Thank you.
Thank you so much.